So how did I know that dentistry was my calling in life? A lot of people who come to shadow me ask me this question: how do I know dentistry is my calling? And there are a lot of people that will say, well, I want to help others and I want to do dentistry because I have been to a dentist before and it seemed like a really nice profession, which is great answers. But I think when you're sitting in an interview with a panelist of clinicians sitting in front of you trying to get you into dental school, helping others is a very generic answer. And I think it's an answer they almost hear from 99% of people that they're interviewing. So try and make yourself a little different. Don't start with the whole generic, I want to help people and this is why I want to go into healthcare, because I think a lot of people in healthcare are helping people, but there's also a lot more to healthcare than just helping people. So I would sit down for you and I would write down a list of things that you value, like you genuinely value as a person and you want to have in 5 years time, in 10 years time, or even in 15 years time. But don't sit down and say, I want to help people, because you could be a nurse, you could be a psychologist, you could be a teacher, you can do all of these things to help people. So I'm talking about values that actually matter. So family time, like these are the things that I've listed that really I value: traveling, sleeping. Sleeping is a big thing. And for me, I always laugh because I could have never done medicine because I love my sleep and I could never, ever do night shifts. And anybody who says that they can do a 24, 36-hour night shift, I bless them and bless their soul, but it will never be me. So if you value sleep, you can't really do, medicine rotations because you're going to go insane like I would have. But entrepreneurship was something I really valued. Work-life balance and art. I love sketching. I love using my hands. People management and patient interaction. This was also a huge one. I love the fact that I get to talk to people in dentistry. There are few healthcare professions that, like optometry, which is something that I looked into initially, where you do get to have a lot of interactions, but you are sitting in a little bit of a darker room. The appointments are a little bit more, I guess you can say, shorter. You don't have an assistant by your side. So you are a little bit isolated because as soon as that patient leaves, you're kind of by yourself again. So I wanted to be an optometrist and I thought, oh, I can't really sit in a dark room and hang out by myself all day in between patients. So I'll just get too lonely. So yeah, you have to look at all of these things because you have to do it for the rest of your life, and you can't overlook these small things now because you might be okay with it for a few years, and then 10, 20, 30 years of your life of sitting in a dark room, it might not be your forte. So what and also write down on a piece of paper what you don't enjoy. So I don't enjoy a lot of paperwork. I don't enjoy long procedures or sitting down and still for too long. So like a surgeon, like I could never do a heart surgery for 10 hours. Like don't come to me for heart problems. But these are the things, like I said, you need to sit down, look at your strengths, look at your weaknesses, and write down a list of what you actually want to do and want to have in the future. Because this is really going to help you narrow down sometimes in healthcare which niche you really want to go into. So it helped me narrow it down, and maybe for you as well. I always tell people, try and shadow as many different healthcare professionals as you can, because the more that you see, the more that you know you don't want to do this and you rather want to do this. I went and shadowed optometrists, lawyers, chiropractors, dentists, medical doctors, you name it, I went and shadowed it. And you think that, hey, no, you know what, I really want to do dentistry and I just want to stick to dentists, shadowing dentists, which is fine, which is great. But you learn things from other professions and you can apply that to dentistry if you do decide to go down dentistry as your main plan A. But it doesn't mean that you're wasting your time by going and networking with other professionals. So I always say to people, it's better to know before that you really love dentistry by eliminating all the other professions rather than going into dental school and then figuring out you don't really like it and you like something else instead. And I say this with a little smirk on my face because it's so sad, because in my dental school, I have seen in my first year, we go from a size of 100 kids to 80 kids because 20 of them dropped out of the first year and said, I don't want to do dentistry anymore. And it's so sad because you invested a lot of time, a lot of money, and a lot of just mental effort that could have been avoided had, I'm assuming, had these people shadowed other professions or shadowed dentists in general. So it happens to almost every year. You will always have a first year dental school class decrease in size as the years go on. I just hope that maybe you'll be one of those people that will stick it through and won't give up after first or second year. But yeah, don't choose healthcare for the money. Don't do it. It's not worth it. You can get rich much faster in other professions. Do healthcare for many other reasons, okay? Just not for the money. The money is great, but it's not going to get you rich fast. So don't let anyone fool you into thinking that. This is an important slide, I think, for you to see, because there will be a lot of people, and I still get messages till this day from doctors, from dentists, from chiros, from all healthcare professionals, where they go into it, they finish the degree, they start working, and after a couple of years, they feel this burnout. They feel like it's not the right profession. They feel like they have gone into something that they don't want to do for the rest of their life. And there is literally 25,000 people in this Facebook group. The Facebook group is called Alternative Careers for Doctors. So you can imagine that there are a lot of people in this world, and not just dentists, just in healthcare professionals in general, where people have gone and spent a lot of time and money into becoming doctors and dentists, and then they realize they don't want to do it. So like I said, go and network as much as you can, shadow as much as you can, do as much as you can before you start, because once you start, you got to really put your heart and soul into it. And I don't want to see you guys being one of the group members in this Facebook group. I want you guys to genuinely love your job because you know you've eliminated everything else and this is what you want to do in life. And also, I think it's a little bit of a choice. Not everything is rainbows and butterflies, even in dentistry, even in medicine, in any profession. So learn to kind of choose to love the things that you're doing, because sometimes there'll be moments of stress, there'll be moments of downtime. But wake up every day and say, this is what I love and this is what I'm going to stick to. And it's a little bit of a mental mind game. So don't be afraid to remind yourself every day that you love it.